longer than expected telephone conversation with Vice President Mike Pence, along with Dr. Birx, and I was very pleased to raise some issues with them, but also to hear their response. Dr. Smith was able to sit in on some of that call, but I raised the issue with them about where we are in Arkansas, and as we look to the future, that we're going to need more ventilators down the road. And he gave us confidence that when we need ventilators, we're going to have ventilators. Now, that doesn't stop us from planning and working and trying to acquire what we need to acquire, but certainly the Vice President and the President understand the future needs that a state like Arkansas has, and they're committed to work with us in meeting those needs. I was also delighted to have Dr. Birx join the conversation, and actually, I was talking with the Vice President. He saw Dr. Birx out there and called her into the conversation, and I raised the issue of where we are in modeling here in Arkansas, and she was delighted with what we've done with our social distancing, with our restrictions that we have in place, and also the success that we're having in terms of reducing the arc and flattening that curve. And I asked her help in continuing to look at our modeling in Arkansas to get an idea of the future. So we're going to be sharing data with them, and hopefully we'll have their input into our future modeling as we might have to adjust in the future. I'm glad to be joined again by Dr. Nate Smith. We have Secretary Hurst here to make some comments about our state parks. I also have Secretary Mike Preston from Commerce that needs to talk about unemployment insurance and how they're handling the crush of unemployment applications that's coming through their department. Yesterday, I reported 523 cases of coronavirus in Arkansas, COVID-19, with 64 hospitalized. Today, that's had an increase of 61, and that raises the total of COVID-19 viruses to 584. It leaves 56 hospitalized and 25 on ventilators that Dr. Smith will talk about. There's been 2 additional deaths since yesterday in my report, bringing the total deaths to 10. I want to speak about testing for just a minute. Dr. Smith has worked very hard with our labs to make sure that we have the reagents that are needed. And over the last 24 hours, we've had 65 tests performed by UAMS, 147 by the Department of Health, and commercial labs 691. That was another exciting point to the Vice President, because they've really put a lot of emphasis on the commercial labs and how they're adding to the mix of the states. And clearly, even though it's a little bit delayed, they're giving us a bulk of the testing information across Arkansas. So as you can see, that's over 800 tests in the last 24 hours, which gives us a significant understanding of where we are in the state, even though we'd always like to have more, and we'll continue to work on that. That leads me to an announcement today, and that is I'm very pleased to announce a partnership with Walmart, with the state of Arkansas, and with Quest to initiate a pilot project for a drive-through testing facility in Benton County, in Bentonville, that will be focusing on first responders and healthcare workers that show symptoms. And this will put a focal point on them to make sure they have immediate access to testing if they need it. They will be an app that will be available so that they can do a self-test as to whether they need a formal COVID-19 test, and if they meet those requirements, then they'll be able to go through the drive-through, be safe for everyone, and get tested in a very, very quick turnaround time. I'm very proud of that partnership with Walmart. They've been working on it nationally, but they wanted to be able to bring one of their pilot projects here to Arkansas, and as we get the everything working well in Bentonville. Hope we'll be able to expand that to other parts of the state. And that partnership between Walmart, the state, and Quest Laboratories, it will be a very significant step forward in our testing capability. Finally, before I turn it over to Dr. Smith, I wanted to mention our state parks that I've asked Secretary Hurst to review what more restrictions we need. I was concerned about out-of-state visitors that are coming here, also about the crowds that are not following social distancing requirements and guidelines that we have. Her recommendation was that we move only to day trip only use of our state parks where there's not overnight use of the facilities. Secondly, to restrict some of the parking that will limit some of the access. And thirdly, to give our park rangers the ability to enforce the guidelines to a greater extent. She'll go into this in a little bit more detail. I also wanted to say that in reference to the Buffalo River National Park, the scenic national park that we all value so much in Arkansas, that I talked to both local officials we've heard word from, our state legislators that are there, but also I talked to the park superintendent last night late, and the conclusion I reached is that I will be recommending to the Secretary of the Interior that the Buffalo River Scenic National Park be closed through this emergency, at least for a time until we can get a handle on it, until we feel like it's safe to reopen that. That's a decision that we've made by the Secretary of Interior, but it has my recommendation that I have made to him for that closure. And I advised the superintendent of the parks of that point as well. To illustrate it, yesterday, which was not spring break, that was just a regular day on early in the week, there were 60% of the visitors were from out of state. Now you think about that in terms of hot spots across the country, the fact that other parks have closed certainly points to the need that if we're going to try to limit out-of-state visitors and the spread of COVID-19, that we needed to take this step, and I made that recommendation. So with that, let me recognize Dr. Nate Smith for his comments.
Thank you, Governor, and thank you for your leadership and for your really tireless efforts to protect the people of Arkansas and to support our efforts at responding to COVID-19. And the Governor won't mention it, but the Vice President had some very nice things to say about our Governor and his leadership. I want to give some more detail on our numbers. As the Governor's mentioned, we have a total of 584 cases. That's up 61 from yesterday. The gender and racial distribution is pretty much the same as it's been. We have 18 children and 170 adults who are age 65 or older, and 396 who are aged 18 to 64. We have 8 of those are pregnant women. 50 have diabetes, 40 have heart disease, 26 have chronic lung disease, 12 have chronic kidney disease. We have 1 with chronic liver disease, and 18 who are immunocompromised. 84 of our 584 positive cases are healthcare workers. That's up 5 from yesterday. And I don't yet have the breakdown by profession, but we're working on that. We'll have that tomorrow. We have 51 who are residents of nursing homes. That's up 4 from yesterday. There are 56 who are currently hospitalized. That's actually down 8 from yesterday. And we have 25 of those who are on ventilators. That's up 2 from yesterday. There was a question previously about how many have ever been on a ventilator. We've had 32 total who have ever been on a ventilator due to COVID-19 in Arkansas. And we've had 90 who have ever been hospitalized due to COVID-19 in Arkansas. As the Governor mentioned, we have 2 additional deaths, so we have a total of 10. Those 2 are both in that age group greater than 65. And we have 42 who have recovered That's up 7 from yesterday. I did mention that we have 4 additional nursing home residents who have tested positive. 2 of those were at the Villages of General Baptist in Pine Bluff. That brings their total up to 4 residents who have tested positive, and 2 of those are from the waters of Whitehall, and that brings their total to 8. We are very concerned about our nursing home population. They're a very vulnerable population, long-term care facilities in general, but nursing homes in particular are places where COVID-19 is known to spread quickly, and we're very happy that we've not seen that kind of explosive spread in the nursing homes where we have positive cases, but it's something we're watching very carefully. In fact, we have support for that from our partners. Was on the phone with Roche Diagnostics, and to support us in our efforts to test all of the residents and all the workers at the nursing homes where we have had positive cases. They have sent us additional reagents for our automated extractor, and we received those this morning. That's enough for us to do 480 of those tests, so that was very, very welcome. In terms of our lab testing, we have been able to scale that up. Yesterday, the Arkansas Department of Health Public Health Lab did 147 tests, which is the largest number that we've been able to do in a single day. Our total tests, UAMS, Arkansas Department of Health, and commercial, yesterday was 903, and our total testing in the state to this point is 7,124. So we are making progress, obviously still not where we hope to be to really get a good picture of what's going on in our state, but we're certainly making progress in the right direction. And lastly, I received a text from a friend this morning. Hey, Doc, what can I do to help save the world? And I think there's a lot of Arkansans who want to know what they can do. What can they do in the midst of this really historic event? And my response was, 1, you need to take care of yourself. Make sure that you are doing the things that you know to do to protect yourself from being infected with COVID-19. 2nd, check in with as many other people as often as you can. There are a lot, especially of our older Arkansans, who, doesn't hurt to have a phone call, someone checking in on them, making sure they're doing okay. And then I would say for all of us, 3rd, remember that if we work together and do the things we know to do, we're going to get through this okay. And with that, I'll close and turn it back over to the governor.
Thank you, Nate, and Secretary Hurst.
Thank you very much, Governor. The recommendation that we made to the governor last night was based on 3 things. First of all, actual visitation data that we have collected through our online reservation system at state parks. Secondly, observations on day use from our park staff and from the public. And finally, best practices from other states. It is our desire to keep state parks open, but only where it is safe and manageable to do so. On this Friday morning, April 3rd, we will move to day use only across our state park system, eliminating all overnight opportunities. This is consistent with 28 other states, and we believe it will further reduce the number of out-of-state visitors that are coming to Arkansas. We're adding additional measures on top of this day-use-only scenario to further limit crowding and reduce risk. For example, the parking situation at state parks can sometimes get so crowded in the parking lots that it overflows to the highways and streets surrounding the parks, and we are going to designate that only parking is allowed on site in approved lots. So at some state parks, they'll be able to close gates. Not all of them can do this, but some of them will be able to close gates to visitors when the parking lot is full. They'll also be able to issue citations if overflow parking goes out onto the highways and streets to get to the park. So our superintendents will be watching for that and managing that. We will also close some trails that are particularly problematic. Two examples that I can share with you today: Cedar Falls Trail at Petty Jean State Park will close, as well as the East and West Summit Trails at Pinnacle Mountain State Park. Our park rangers will travel throughout state parks and work to disperse gatherings. Superintendents and interpreters, our uniformed staff, will actively work to educate visitors on site. And finally, our park rangers that might be stationed at another park in another part of the state that has less visitation will be deployed to parks that are more overcrowded so that we can better manage crowds. We'll move those staff resources across the system to where they are needed the most. Full information on all of these changes and full trail and site closings will be posted on the State Parks website and on our social media pages. We are continuing to work on that through the day, but we should have it up there by this afternoon. And if these measures aren't enough to address issues of overcrowding and inadequate social distancing, we'll pivot and make new recommendations. Very fluid situation, but we are staying on top of the data and the best practices across the country, and we will adjust as needed. Thank you. Thank you, Governor.
Thank you, Stacey. I know your teams worked very hard on that and continue to do so, and the park rangers, express my thanks to them. And Mike Preston has done an amazing job with his team there, addressing the historic flood of unemployment insurance applicants, and also to get money out to the small businesses that are hurting in Arkansas today. So, Mike, I know you've got some points you need to make.
Thank you, Governor. I appreciate your leadership, and to fellow cabinet members, your leadership as well in this time. I do want to speak specifically about our unemployment insurance and just a couple of updates. And first to, all the workers who are out there around the state in our unemployment offices. You guys are on the front lines working, around the clock essentially right now, and we appreciate your hard work and your dedication to this. Understanding we went from processing about 1,000 claims a week to literally falling over a cliff and having to do 30,000 next week, and by all indications we'll be at that same level this week. So trying to keep up with that volume is certainly putting a strain on our system and our people, but appreciate the work they're doing. What I want to specifically address is the pandemic unemployment compensation, which was a part of the CARES Act that was passed. This addresses those self-employed workers, the independent contractors, the gig economy workers. We are still waiting guidance from the Federal Department of Labor on how that will be implemented. What we're seeing now is a flood on our system of those workers calling and trying to go ahead and apply for the unemployment insurance. We are not able to process it. So I'd say please hold off if you're one of those one of those workers who fall into that category, because right now we cannot help you until we get the guidance from the Department of Labor. As soon as we do, we will send out a news release. We'll send out through our social media channels just exactly how that's going to work. We hope to have that sometime later this week from the Department of Labor, but right now we're seeing a backload on the system because of that. We've added additional employees. We've reassigned employees within the Department of Workforce Services and within the Department of Commerce who are now answering phone calls, inputting into the system. So you have folks from insurance, from economic development, from finance, all trying to handle this process as we're trying to go through the onslaught of claims that we're going through right now. So please be patient. Go to the website. It'd be the easiest way to do it. But again, those folks who are looking at the pandemic unemployment compensation, that will have further guidance from the Department of Labor this week, but until then, we're not going to be able to process your claims. So if you get on there and spend a lot of time and it kicks back, that's why. And then you call and ask the questions, it kind of holds up the phone line. So we want to keep those phone lines open. We have added additional capacity to the website, so that should be moving faster today. We're excited about that, and hopefully we're going to be able to keep up with this demand. Thank you, Governor.
Thank you, Mike. With that, I turn it over for questions.
Last week, I think it was, about putting together a task force made up of legislators and people you would put together to address state needs. Has that been done? Have they?
Well, yesterday, I created through executive order a task force. It was a working group for the CARES Act fund and steering group for that purpose. That is legislators and my administration. And so that's the only thing I can think of that I referred to. But the purpose of that is we're going to have a large amount of federal dollars coming in between now and December 30th. And I wanted to have legislators, my administration, working together, making recommendations as to how those funds should be utilized to address the current crisis. And so that is in works. That executive order has been entered, and that steering group is moving forward. They have been selected. They have not met yet. They have been selected. Yes.
In your phone call with the Vice President and Dr. Burks, did they say anything about our status in terms of having a stay-at-home order? I know Florida just issued an order. Did they say if that's something that we should be near?
No, they are very pleased with the way we're bending the curve, and I talked about the restrictions that we have in place. And you've got to be mindful, like Texas, Governor Abbott issued an order, and it basically said, defined what essential services are, but did not direct a stay-at-home for everyone else that's not engaged in essential services. So, we are taking it very thoughtfully. We're going through it as to what we need to close to accomplish our objectives. And, most governors just simply broaden the definition of essential services so everything's an essential service. And so we can do that, and we might have to do that because there is some, public messaging that, if you're not doing something important, you need to stay home. I think we've conveyed that. I think we have conveyed that through everything that we're doing. And so the Vice President's office, we just articulated what we're doing here. They applaud that. Clearly, we're getting ahead of the curve. And the key is that people pay attention to what we're doing. And I think we've taken those measures. You look at, the malls, for example. I mean, even though they're technically open, the people are staying at home. There are some essential services that are offered, goods that are needed, that can stay open. But people are handling this in a responsible way. We just want to enforce that and to make sure that those that are not being responsible are reminded of who they can harm. And so I think the Vice President is pleased with where we are, but we'll continue to look at that with them as to whether anything in addition should be done. Mike.
Representative Murdoch tested positive. Just your reaction and any suggestions in light of that for the fiscal session, particularly for Mr. Doctor?
I'll let Dr. Smith address that. He advised me, and of course he kept the confidentiality, but I understand that there's public information on that. And I spoke with Speaker Shepard as well. The social distancing that they accomplished during the session gives the legislators confidence that were not at risk during that time, and that is the benefit from it. And so it just reinforces the importance of what they did, the steps that they took, and obviously as we enter into the time of the fiscal session, it reiterates or emphasizes the importance of those measures that they took. Dr. Smith?
With the estimation, should the Joint Budget Committee be meeting in Big Mac?
Well, first, as far as this specific case, based on what we know about the timing and the measures that were used to accomplish social distancing, we don't believe that there was a higher significant risk to the other legislators. However, we will recommend to them as well as to anyone else, if you develop symptoms, tested and self-isolate until you have those results back. So that meeting is important. The measures that they took in the House to spread themselves out and to maintain social distance, I think, are laudable. They went over those with us before. They went over their plans with us before they put them in place, and I trust that they will in future meetings as well.
He says he wasn't showing any symptoms, so why did he get tested?
I don't have any specific information. What I've heard is that he wanted to get tested. And it is true that there are some people who will initially have no symptoms, but will test positive, and then they may go on to develop symptoms later. Now, when someone doesn't have symptoms, it's a little difficult to interpret a negative test, though, which is why we generally don't recommend it. If the test is negative, it could be that that person isn't infected, or it could be that they are infected, but they just don't have enough virus yet to be picked up on the test.
So if we're trying to prioritize things, how does somebody who's asymptomatic get in?
Our priorities, I think I've shared before: healthcare workers, those who are hospitalized, nursing home or long-term care facility residents and workers, and then those who are symptomatic, especially those who are age 65 and older and have underlying medical conditions. But there's a fourth classification: is a physician or a provider feels that there's a compelling reason, some decision that would be made based on that test, then we'll defer to their judgment and go ahead and that's supported. We generally won't do those tests at the Arkansas Department of Health unless there's a time sensitivity to it. But people can send those off to a commercial adults.
More specific on that 19 to 64 range in terms of how many positives we got? Are they trending more towards that 64, or is it a pretty even distribution?
Well, the highest risk, of course, of more severe outcomes is with those who are older and those who have underlying medical conditions. But we continue to have plenty of cases in younger adults. Again, a higher proportion of them are going to end up having mild symptoms, but if you look at our numbers from today, almost 400 of our 584 are those I call younger adults, age 19 to 64. Since I'm in that category, I'm going to consider them younger adults.
Will any of the quick result tests from Abbott Labs be in use in Arkansas?
We hope that we hope they will, and we hope that we'll get them as quickly as possible. I understand that we are not the highest priority because we don't have one of these explosive outbreaks going on right now. But I talked to CDC Director Robert Redfield last night, and he was optimistic that we will be able to use those. They have a very rapid turnaround, so you can get results right away. So they're very helpful in certain situations where you need that information quickly. And we're already working with Abbott to see how we can get those results reported to us in real time.
The White House estimated that if everybody does what they should, we'll have like 200,000 deaths in the U.S. Did they give you any estimate for Arkansas, or do you have any estimate for the number of deaths that we'll have here?
No, we really don't. The question was about how many estimated deaths, and again, that's very much a ballpark figure. I know for the country. For Arkansas, we really don't know. It really depends a lot on what we do today. So far, our epidemic curve has been flatter than most places, and a lot of this has to do not with just the number of cases that you have, but who's getting sick. If we can protect our nursing home residents, which is one of our top priorities, then we should have fewer deaths. And if we can stretch it out over a longer period of time so we don't have that surge that overwhelms our system, if we can have our peak later than other states, then there'll be more resources, particularly ventilators, available, and less need to make difficult decisions.
Of the most recent deaths, did any of them have any underlying conditions?
Yes. one of these two at least had significant underlying conditions.
And then I guess for anybody who's in treatment, what exactly does that look like, or what are we doing to actually treat the people who are suffering from COVID-19?
Yes, the question is, what do we do to treat people who have COVID-19 infection? There are no proven treatments for COVID-19 at this point. There are things that have been tried and some that have more promise than others, but the major and most important thing is supportive care, especially for those who are sick or who are hospitalized. Make sure they have IV fluids, make sure they have support, oxygen, if they need a ventilator, ICU care if they need it. These are the things that we know get people through and help them to survive. Now, there may be other treatments that come along that we find work well, but right now we don't have any proven treatments for this virus.
Where were those two additional deaths? Did I miss that?
I know that at least one of them was in central Arkansas. The other one, I don't have complete information at this time.
MSNBC mentioned last night that Rogers, Arkansas could potentially be another spot where this could really flare up. Have you seen anything that would suggest otherwise, or anything that would support or not?
Well, Northwest Arkansas has always been an area that we've been looking at very carefully. Initially, because they had a lot of international travelers, and they also have one of our largest population centers. So we've been watching them very carefully. So far, we've not seen an escalation in the number of cases. I think the people there are very concerned and are taking pretty significant actions at social distancing. So if they continue to do that, hopefully we'll continue to see a relatively low number of cases.
Dr. Smith, you mentioned the ultraviolet light and the role that plays heading into the summer months. Could you expand on that a little bit, and the humidity and that?
We know that ultraviolet light tends to degrade most viruses, and in fact, some decontamination protocols actually use ultraviolet light sources. But ultraviolet light from the sun, like you get outside, is also very helpful in decreasing the risk of transmission for a wide variety of germs, pathogens. And so that's why I've encouraged being outside and keeping a healthy distance is a good thing. Hopefully, as the summer months come and we get longer days and more ultraviolet light, we hope that we'll see fewer cases. But remember, this is a new virus. It was first reported December 31st of 2019. It just got its 2019 by 1 day. If it had been 1 day later, we'd be calling it COVID 2020. But we don't have a summer's worth of experience, but we're hopeful.
One last question, maybe?
Can you expand on the timeline of this partnership with Walmart and this clinic, where it stands and that?
They expect this to be in operation early next week. I know, because I've been in discussion with them, that they've been working on this for some time, and this is a quick time frame to get it out, but they hope to be operational next week, where this is available for first responders, healthcare providers that have a concern and believe they need to be tested. With that, thank you all very much today.
You are watching the governor's daily press conference on coronavirus here in Arkansas. There have been 2 more deaths, bringing the total number of deaths in our state to 10 now. There are 584 patients with coronavirus in the state of Arkansas. And the breakdown of the numbers: 18 children, 170 ages 65 plus, 396 ages 18 to 64. We learn of the 2 latest deaths. Both were greater than age 65. One from central Arkansas area and one with significant underlying health issues. We also learned today more about the state parks that have been flooded with people to get outside. 2 state parks are closed: Cedar Falls Trail at Petit Jean and the east and west summit of Pinnacle Mountain, 2 very popular locations for central Arkansans. They are now closed. And the governor also recommended a national park, the Buffalo River River Scenic National Park be closed. As he referenced some data, some 60% of out-of-state visitors there at our Buffalo River Scenic National Park. So he is recommending that it now close because they're not seeing the social distancing that they so desperately need right now to contain the spread of this virus. And Mike Preston, our Commerce Secretary, said that our state went from an average of about 1,000 unemployment claims to 30,000. He urges people to please be patient as they await more federal guidance for the pandemic unemployment compensation, which so many people, independent contractors, are looking for and need right now. He hopes to have an answer soon and urges people to please be patient. There's been an increase in testing in Arkansas. Dr. Nate Smith, our health secretary, shared that 903 tests were run in the state of Arkansas just yesterday alone. That is a big increase from what we have been seeing. And again, just to recap, 10 total deaths in Arkansas, 2 new and 584 cases of COVID-19. We will continue to cover COVID-19 in our state and how it is impacting all of us tonight at 5, 6, 6:30, and 10, and always on our website, thv11.com. We'll see you tonight.